Couch Sessions. My name is MUGAMBI KITHINJI. Couch Sessions are a platform where we talk, we get to nurture ourselves, and most importantly, we get to better our lives. I'm sure after each and every episode, your life will be better. So sit back, relax, and I hope you'll enjoy this episode. Welcome to episode 2. I hope you enjoyed episode 1 and shared with a friend. This week, I'm talking about the misapprehension of mental health. As we all know, World Mental Health Day was a few days ago, and I was able to follow the conversations, the discussions around mental health. For instance, this year's theme being making mental health and well-being for all a global priority, the discussions were centered around how mental health becomes a worldwide conversation. While doing so, there were different practitioners, health advocates, as well as the general public that participated in the discussions, each giving their own take on how mental health can be made a global priority. As an active listener and a good journalist, I was able to take notes and observe a worrying trend. There was a lot of misapprehension, so much so terming mental illness as any other disease. In one of the radio stations, I got to hear a doctor that had been contacted call it kiugonjwa tu cha kiakili, reducing mental health to a common cold, something that comes and goes. This got me thinking, why don't we understand mental health? With improper understanding of mental health, we are bound to make prideful judgments, resulting to the terming of mental health as any other disease. The genesis of this stems from our childhood. In school and home, there were rarely any discussions around mental health, and if there were any, it was when the news channels highlighted Mathare Hospital. If the foundation is wrong, how do you expect the buildings to stand? Also, there are not enough materials on mental health. If you visit a library, mental health is given a chapter in a medical book, while other diseases, there are journals dedicated to the research and treatment methods. Why? Or at times a column in a newspaper. While you find headlines such as junk food is not good for you taking center stage, or a celebrity story, as this happens, more and more of us won't be able to understand mental health. We'll be left in limbo. And with no information, we are bound to stereotype those with mental health conditions. Whenever we hear someone has a cycle of depression, first thing we tend to think is that they're not appreciative of what is around them, their family, their work, their money, and also life in general. When someone is stressed, we try to minute their stress and compare it with ours, sometimes telling them that is an issue. Commonly we'll hear, hiyo tu ndo inakustress, ama hiyo tu ndo inakusumbua. A friend visiting a counselor is a friend who has given up on life. A friend who's in a rehabilitation center is a friend to be avoided. Why so? Don't we know that we are causing more harm to an already bleeding arm? Inflicting pain to a wound? As studies show, a majority of people are afraid to speak out and share the challenges that they are going through. Someone would rather suffer in silence than talk, which is a very bad thing. Because the more you remain mum, the more the problem hits on you. Hence the spasm that has been witnessed in the recent past. You find a father killing his entire family, a police officer shooting his fiancée to death, a mother poisoning her family, and a majority of youth indulging in drugs, which led the international media house BBC to air a documentary on suicide in Kenya. The numbers are so high that they leave you in shock. 6.1 per 100,000 population. Globally, 700,000 people die from suicide annually. Such numbers are shocking. I wonder where we are headed as a society. Still, the numbers are not giving an awakening. We are still treating mental health as a by-the-way disease, which should change. We shouldn't let this persist, because misconstruing mental health can have adverse effects. It is linked to the cases being reported. Let us say no and make changes. For instance, start teaching children about mental health so that when they become adults, they have a better understanding. Secondly, medical practitioners should pump in resources and enough money in the research and prevention of mental health. The same seriousness given to malaria and cancer should be given to mental health. This is because if 700,000 people globally commit suicide, how many more do you think in the next 10 years will do so if nothing is done to address the issue? Well, my dear listener, that has been this week's episode on mental health and the misapprehension surrounding the matter. I hope that you have learned something and that you will be the change that the world needs. Be empathetic to those going through mental health challenges and those in the medical field. Do inform us well. Adios. Let us meet at episode 3.
Yeah.